Air pollution is the presence of harmful particles and gases in the air, and it can be caused by anything from natural events such as forest fires to artificial emissions from factories. The severity and amount of pollution has been on the rise globally in recent years due in part to unsustainable practices and global warming. Many diseases can be caused by the inhalation of these smog particles, and they are mainly pulmonary diseases such as lung cancer and chronic respiratory conditions. They also weaken the body's ability to fight other kinds of illnesses. This combined detrimental effect has led to pollution being recognized as a major public health issue.
So who does it affect? According to the World Health Organization, 98% of all people who live in developing nations and 56% of those who live in developed countries live in an area where air quality does not meet WHO guidelines. Total mortality in 2013 was found to be about 30 deaths per 100,000, and as we look at morbidity, a link has been found towards the hospitalization of elderly and air pollution. Now, what causes these factors? Racism and redlining causes many to be confined to areas that are of poorer quality. The lower the socioeconomic status, the higher the probability of living in more dangerous and exposed areas.
Air quality guidelines have been set at the federal and local levels. WHO and the EPA use these guidelines to manage and monitor air quality. Countries like Europe issued the air quality limit values for similar costs. Japan established a Kyoto Protocol of 1997 and added more policies later. China also adopted these policies too. Education is another important aspect in managing the rise of the problem. Different countries have promoted the awareness through campaigns and continue to educate the public about the current matter. Lastly, individuals can make decisions to alleviate the issue for themselves by incorporating an antioxidant-rich diet, which helps to limit the health outcomes caused by air quality factors.
However, these current solutions are only moderately effective. Government agencies like the Environmental Protection Agency still have very limited capabilities in directly creating new policies about air pollution. Oftentimes, corporations sue for deregulation, limitations for new policies, and discredit any forthcoming scientists. Accessibility to fresh fruits and vegetables rich with antioxidants may be limited due to affordability, transportation, or lack of nutritional biodiversity.
Information is readily available to the public through scholarly articles or articles written by health organizations about the health effects of air pollution. See a pulmonologist, cardiologist, or oncologist to assess symptoms that may be caused by air pollution. A misconception is that individuals are responsible for reducing air pollution. However, the best way to protect public health is to reduce or eliminate air pollution caused by big industrial corporations. Public health practitioners and officials can put measures in place that control these corporations.